Welcome to today's program. In this video, we will learn about a very important health problem for the elderly, pneumonia. This is a common disease, especially dangerous for the elderly, because they often have a weakened immune system and poor resistance. So what is pneumonia in the elderly, and what should we pay attention to protect the health of our loved ones? Pneumonia in the elderly can have many different causes, and because the immune system of older adults is often weakened, they are more susceptible to the disease. One of the most common causes is bacterial infection, especially Streptococcus pneumonia. This bacteria can enter the lungs through the respiratory tract, especially if the elderly person has had a cold or flu before, creating favorable conditions for the bacteria to grow. In addition, viruses such as influenza or respiratory syncytial virus, RSV, can also cause pneumonia. These viruses weaken the lungs and airways, making the lungs more susceptible to infection. Some cases of pneumonia in the elderly may also be related to the inhalation of food, drink, or other liquids into the lungs. This is more common in older adults who have difficulty swallowing, such as those with Parkinson's disease or stroke. Finally, other factors such as smoking, environmental pollution, and chronic diseases such as diabetes, heart disease, and chronic obstructive pulmonary disease, COPD, can also increase the risk of pneumonia in the elderly. Care and prevention through vaccination and good personal hygiene are important to protect the health of older adults. Pneumonia in the elderly is a serious disease that needs to be diagnosed and treated promptly to avoid dangerous complications such as respiratory failure, sepsis, or even death. The process of diagnosing pneumonia often begins with a doctor performing a clinical examination, listening to the breath to detect abnormal signs in the lungs, such as crackles or decreased breath sounds. A chest X-ray is then an important tool to help determine the location and extent of inflammation in the lungs. In addition, the doctor may also order blood tests to check the level of white blood cells, a sign of infection, and other indicators related to general health. In some cases, a sputum test is also performed to determine the type of bacteria or virus causing the disease, thereby providing an appropriate treatment regimen. Accurate diagnosis and early treatment are very important, helping patients avoid serious consequences and increase the ability to recover. Treatment of pneumonia is mainly antibiotics if the cause is bacterial, or antiviral drugs if caused by a virus. In addition, patients need to rest, drink plenty of water, and supplement nutrition to increase resistance. Take medication as prescribed by your doctor. Make sure the patient takes antibiotics, anti-inflammatory drugs, or antipyretics in the correct dosage and at the prescribed time. Do not stop taking the medication on your own, even if the symptoms have improved. Nutritional care. Provide a nutritious, easy-to-digest diet, including foods rich in protein, vitamins, and minerals to strengthen the immune system. In particular, encourage the patient to drink plenty of water to help thin phlegm and reduce inflammation. Get enough rest. The patient needs to rest a lot for the body to recover. Limit strenuous activities, but still encourage them to move gently to avoid fluid buildup in the lungs. Maintain hygiene and a cool living environment. Ensure the living space is clean, airy, and free of dust or irritants. Avoid exposing the patient to cigarette smoke or polluted environments. Monitor for unusual signs. Always watch for signs of health problems such as difficulty breathing, persistent high fever, chest pain, or increased coughing. If symptoms become more severe, contact your doctor immediately. Physical therapy. In some cases, your doctor may recommend breathing exercises or percussion to help expel phlegm, helping to improve respiratory function. Vaccination and prevention of recurrence. After recovery, consider getting a flu or pneumococcal vaccine to reduce the risk of pneumonia recurrence in the elderly, while maintaining a healthy lifestyle and regular health checkups. Home care with close monitoring will help the recovery process effectively and minimize the risk of complications. Vaccination. This is the top measure in preventing pneumonia. The elderly should get the annual flu vaccine and pneumococcal vaccine to reduce the risk of respiratory diseases, especially pneumonia caused by pneumococcal bacteria. Maintain a healthy immune system. Provide a healthy, nutritious diet with foods rich in vitamins, minerals, and protein to help strengthen resistance. In addition, vitamin D supplementation is also very important as it helps improve the body's immune function. Good hygiene habits. Washing hands regularly with soap or antiseptic solution is a simple but effective way to prevent the spread of bacteria and viruses. Avoid touching your face, especially your mouth, nose, and eyes, to limit the invasion of pathogens. Keep your living environment clean. Make sure your house is airy, clean, and free of mold. Limit exposure to dust, chemicals, and respiratory irritants. In particular, the elderly should avoid cigarette smoke, as it is the leading cause of lung damage and increases the risk of respiratory diseases. Increase physical activity. Maintaining light physical activity every day, such as walking. Light exercise helps improve overall health and improve lung function. Exercise also helps the elderly body fight pathogens better. Control underlying diseases. Chronic diseases such as diabetes, cardiovascular disease, or chronic obstructive pulmonary disease, COPD, increase the risk of pneumonia. Good control of these diseases through taking the right dose of medication and regular health checkups will help reduce the risk of pneumonia. Drink enough water and get enough sleep. Make sure your body is hydrated to keep the respiratory tract moist and help eliminate toxins. Sufficient and quality sleep is also important in supporting the immune system to function effectively. Care and attention from family play an extremely important role for the elderly, especially when they suffer from illnesses like pneumonia. The family not only provides physical support, ensuring the patient receives adequate nutrition and medication, but also helps foster a positive mindset, encouraging them to overcome the challenges during treatment. The presence and encouragement from loved ones can reduce stress, helping the elderly feel more secure and comfortable in coping with their illness. Always remember, prevention is better than cure. Taking care of the elderly requires continuous and thoughtful attention from all family members. Focusing on healthy habits, a balanced diet, and regular health checkups are essential factors in maintaining and protecting their well-being, helping them lead a happier and healthier life. Pneumonia in the elderly is a serious problem, but can be completely prevented and treated if detected early. Always pay attention to the health of your loved ones, especially the elderly in your family. Don't forget to have regular health checkups and get vaccinated to protect them from health risks. Thank you for watching today's program. Please share this video with those who have elderly relatives to protect your family's health together.